Chapter 28 Institutional Strategies to Promote Scholarship in Health Professions Education. P.V. Vijayaraghavan, Latha Ravichandran, Narasimhan Swaminathan. Abstract: Scholarship of teaching learning is gaining attention in health professions education. Recognizing and rewarding SOTL requires good governance at the institutional level. Developing and implementing appropriate strategies for creating a culture among faculty members holds the key. This chapter discusses various factors that contribute to developing an appropriate ecosystem or educational environment. These include institutional vision and mission, transparent policy, procedures, effective supportive system, appropriate recognition and reward structure that can improve the SOTL at the institute level. The chapter draws from the author's personal experience of scholarship development and aims to provide a base for reflection on the institutional governance to promote SOTL. Key words: educational scholarship, governance, leadership, policy, procedures, teaching, learning. Assess need. Scholarship of teaching learning in health professional education has gained attention in the recent past. In an editorial, Singh Chi and Gupta P proposed that SOTL should be considered as a criteria for promotion of medical teachers in India. However, promoting SOTL among the health professions educators is challenging. There are several factors that affect such a move: lack of educational research skills, preoccupation with teaching or clinical duties, lack of dedicated time, lack of recognition or weightage to educational research, and absence of supportive structure including staffing and financial resources are often cited as the main barriers to SOTL. Good governance at the institutional level can play a vital role in achieving the desired goal. Developing strategies to facilitate and steer scholarly teaching towards SOTL across health profession educational institutes is therefore the need of the hour. Understanding the role of institutional support will help educators to convert their scholarly teaching into educational scholarship. Health professions education in India is quite a complex system in terms of structure and regulations involved. Both central and state governments exercise control over the educational system run by the public and private sector, while the medical colleges are regulated by the National Medical Commission. Dental, nursing, pharmacy, and allied health sciences institutes are being regulated by their respective councils. Many of the health professions institutes come under the jurisdiction of universities, which are again of different types. They are accountable to the UGC and subject to assessment and accreditation by the National Assessment and Accreditation Council. The medical colleges under the health sciences universities, therefore, face additional challenge of understanding and applying SOTL. However, irrespective of the type of institute, for ensuring the purpose of the quality of training, enhancing the scholarship of faculty remains a universal agenda. In this chapter, we discuss various aspects of institutional support in promoting SOTL. Brief. Good institutional governance plays a vital role in promoting SOTL. Academic freedom, shared governance, transparent rights and responsibilities, meritocratic appointment are the principles of good governance in academic institutions. Creating community of practices, mentoring, providing opportunities to develop skills required for scholarly work, and implementing transparent policies to promote SOTL at institutional level are key to success. Recognizing SOTL through transparent and appropriate appraisal system will promote SOTL. Contextualize. The co-author of this chapter was identified by the leadership to facilitate the curriculum development initiative of the undergraduate medical curriculum in the institution in association with the Harvard Medical International and also to participate in faculty development programs. The result was an innovative integrated curriculum for the undergraduates. The outcome of this experience led to the institution being recognized as the Nodal Center for Faculty Development by the then Medical Council of India, with her appointment as co-convener of the Nodal Center. The experience gained by her was supported by the institution by nominating her as the member of the Medical Council of India Faculty and Curriculum Development Committees for the competency-based undergraduate curriculum. The outcome was her contribution to the national curriculum and also to lead the faculty training of nearly 3,000 medical faculty over a decade. This expertise was utilized for internal development by her appointment as the chair of the curriculum committee and secretary of the medical education unit that has now evolved into Department of Medical Education. The outcome was scholarly projects and publications in medical education. For example, our recent publications in peer-reviewed journals. The institution supported her by nominating her to educational scholarships, the FAIMER Fellowship, an advanced course in medical education. The outcome was the establishment of the Center for Health, Professionals Education, and the position of Associate Dean Education to oversee the educational activities of the university, including other health sciences. This triggered more faculty pursuing fellowships and PhD in medical education, resulting in capacity building and scholarship in health professions education. The institution now aiming at international visibility, accreditation, and collaboration. Her scholarship has been extended to International Fellowship in Medical Education that offers scholarship for Masters in Medical Education at Keele University. Throughout her career in health professional education, she is mentored by accomplished seniors, then Dean Education and Director Academic Administration of the Institute, later as Vice Chancellor of the University. Describe governance, meaning and importance. Governance includes policies and procedures intended to establish norms and develop strategies towards agreed institutional goals. The good governance ensures accountability, transparency, and stakeholders' participation and successful implementation. Governance also signifies the standards, values, and directions set by the institution through which stakeholders are involved in a transparent, inclusive, and responsive manner towards institutional vision and mission. Within the context of higher education institutions, governance can be defined as the means by which universities and other higher education institutions are organized and managed. In broader terms, the characteristics of good governance includes participation, consensus-oriented, accountable, transparent, responsiveness, effective, and efficient. The principles of good governance in higher education institutes includes academic freedom, shared governance, transparent rights and responsibilities, meritocratic appointment, financial stability, and accountability. Academic freedom allows faculty members to practice scholarly teaching, which in turn will result in SOTL. Shared governance provides equal opportunities to the faculty members to participate in decisions which affect them both direct and indirect. Well-defined merit systems should be in place selection and promotion of faculty members. This principle of good governance shall be the key to promote SOTL in health professional institutes. Recognizing and rewarding scholarly teaching and scholarship of teaching are critical as they contribute towards institutional mission and vision. Health professions institutes should have well-defined governance to promote scholarly activities of its stakeholders. Through the governance structures, routine teaching and learning preparation, delivery and assessment can be converted as educational scholarship if they are shared to a larger audience after peer review process. Higher education institutes should recognize educational scholarship to enhance quality and stakeholders' satisfaction. The performance appraisal system recommended by University Grants Commission provides importance to teaching learning. Institutes shall consider these guidelines in order to promote SOTL, creating a community of practice. Members of community support and motivate each other by developing and sharing resources. In the long run, members of the community develop stronger bond and commits to achieve the common goals as a team. Established communities of practice can positively influence faculty members to understand scholarly teaching learning. Planned activities of such peer groups need to be facilitated by appropriate governance. Health professional education units of the institutes can be such communities to promote SOTL. Establishing and nurturing health professional education units might influence scholarly teaching and SOTL positively. Integrating various education units as health professional education unit will provide opportunities to develop communities of practice. Medical education units will be able to handhold and mentor the educational units of other health professionals to scholarly of teaching and SOTL. The authors of this chapter involved in training of faculty members were approached by a neighboring institute to train their teachers in online methods during COVID pandemic. A short online course was created to train the educators in using Google Classroom, and the impact of training was assessed using a retro pre-questionnaire. There was a significant improvement in participants' perceived competencies using various features of Google Classroom. The findings of this was published in a peer-reviewed index journal. Creating and delivering a course in a short time was feasible because of the involvement in the FDPs at institutional level. This is an example how scholarly teaching could be effectively transferred as SOTL. The co-author's institution has a defined policy on FDP, which provided adequate exposure to faculty members to scholarly teaching. Creating a community within the institute might positively influence SOTL. Promoting the scholarship opportunities in education among the faculty members is vital as it improves the quality of core teaching learning. In their recent editorials, Singh Chi and Buktukpe discussed the need for promoting SOTL. It is important that higher education institutes provide adequate opportunities and create conducive atmosphere to its faculty members to engage in scholarly activities. Role of faculty development programs. As we reflect, scholarly teaching is the foundation for SOTL. Institutes should focus on training faculty members through structured faculty development programs. The faculty members of HPE have limited training in pedagogy. Erstwhile, Medical Council of India and recently National Medical Commission introduced mandatory faculty development programs at the basic, advanced level and curricular implementation support programs. The objective of these FDPs is to improve the quality of medical education by training the faculty members. The details of the FDPs conducted by Sri Ramachandra Medical College and Research Institute, Chennai, are provided in the table below. Pre-revised basic course workshop at Nodal. Number of FDPs, 49. Number of faculty members trained, 743. Revised BCWs conducted at medical colleges with on-site observers from Nodal Center, 70. 1603. AETCOM module, 251. Faculty members trained implemented innovative teaching methods and converted them as SOTL. For example, 1-minute preceptor as a method of PG teaching was implemented by a faculty member and the impact was published in peer-reviewed journal. Facilitating scholarly teaching practices among faculty members through training. Mentoring and appropriate recognition will be the key to SOTL. Creating a center or unit of HPE to promote scholarly teaching might serve as a base to promote SOTL at institutional level. The FDPs should cultivate critical inquiry skills on teaching learning method. Faculty empowerment strategies are considered as one of the key indicators under the criterion governance, leadership, and management for accreditation by the National Assessment and Accreditation Council. It insists on regular faculty development program and transparent performance appraisal. Institutes shall consider educational research publications as one of the key performance indicators in faculty appraisal. which will promote SOTL at institutional level. Mentoring. Kensington M. and colleagues suggested mentoring as a method to inculcate SOTL among early career academicians. Shadowing an expert might improve critical inquiry skills and lead to SOTL. Institute should provide such opportunities by creating community of practice. One-on-one dialogues and consultations with educational experts and accomplished academic leaders might facilitate scholarly activities. Structured coaching sessions in the form of peer mentoring seems to be effective in promoting scholarly activities. Establishing a HPE unit at the institute level might serve this purpose. However, this requires further research prior to generalization. In our institute, medical education unit is well established with experienced faculty members. The success of the MEU is transmitted to other health professionals by creating educational units. MEU is mentoring other health professional education units. Currently, Sri Ramachandra Center for Health Professionals Education functions as a team in imparting quality education. Senior members of MEU handhold the other units in conducting FDPs and educational research, creating transparent policies and procedures to promote SOTL. Institute should have a clear policy to promote SOTL. An analysis of Canadian Medical Institute's policies on promoting educational scholarships revealed wide variations and lack of clarity. It is important to create awareness among educational leaders regarding the importance of SOTL. SOTL shall include any forms of peer-reviewed research and innovation in HPE. The dissemination of such findings shall be through publications or through conference presentations. The objective of any SOTL is that it can be replicated in a scalable way through institutional policies, presenting the finding of educational research in discipline-specific as well as HPE conference can be considered for recognitions. Attending and sharing the findings of HPE research with the larger audience can also be considered as SOTL, such as analyzing journal publications. However, this snapshot survey uses attendance at higher education conferences as a measure. Attendances were analyzed at 3 conferences in the UK between July-December 2008. The country in which each conference delegate was based and for Wales only. Participation in conference will lead to self-reflection about individuals' teaching skills and promote critical inquiry. Recognizing through institutional award will encourage faculty members to improve SOTL. The institutional policies to promote SOTL shall be able to differentiate SOTL from other scholarships, define career path for the educators, focus on all possible appropriate outcomes of SOTL rather only on publications, reasonable awards and recognition for SOTL activities at institutional level, creating support structures. Several challenges in promoting educational scholarships are identified. Lack of time, inadequate knowledge and skills in educational research, and lack of administrative support were some of the challenges documented in the literature. Goldsmith, Marr et al. Through a mixed method study identified the support requirements in promoting SOTL. Lack of educational research skills among the faculty members were identified as an important barrier. This study also identified that merely having an advanced educational degree may not be sufficient to promote educational research. There is a paucity of literature addressing how to support those who wish to do so. Weims, the purpose of this study was to explore faculty involvement in and support needs for pursuing education scholarship. And methods, a purposive sample of 108 medical faculty with an interest in medical education were invited to participate in a 2-phase mixed method study survey and focus groups, providing appropriate training and resources to facilitate SOTL is important. Training faculty members in educational research methods apart from routine FDPs might improve the scholarly activities. We run monthly journal club through HPE, which focus on educational publications. Members of various health professions participate in this club to discuss the published innovative practice. Educational research methods are deliberated in detail during JCs. The impact of this journal clubs is noticed by increased number of publications in peer-reviewed journals and conference presentations. Higher education institutes should encourage disseminating scholarly activity to a wider audience through publications and presentations. This could be possible by creating a community of educators interested in SOTL within the institute. The authors provide a conceptual model along with examples of practical strategies for overcoming resistance to change within institutions. The paper provides examples from a variety of different international contexts to show how incentives and other non-coercive measures can motivate faculty and administrators to weave SOTL into institutional fabrics, and drawing on social network theory and the concept of communities of practice. The paper presents a model with attendant strategies for disseminating SOTL values and practices across all three levels of post-secondary institutions: the micro, the meso, and the macro. The authors argue that for SOTL to take root in organizational cultures, there must be one. Creating a Center for Health Professions Education can be considered as a priority measure to promote SOTL. In his editorial, Chaco VT suggested the measures to be considered at institutional level to promote SOTL. Since 2019 at our institute, we established Teaching Excellence Award with the following objectives: recognize the teaching excellence both as individuals and teams, showcase the institute's commitment towards quality teaching, learning, encourage scholarly activities in teaching and learning, inspire and nurture the faculty members in health professions education. We created a transparent process and criteria to assess the nominees. We were able to identify the faculty members with potential towards scholarly publication. We observed that the faculty members' involvement in educational research is improved as evidenced by increased number of publications and conference presentations. For instance, in last year's simulation conference, 4 members of SRIHER presented their findings and the abstracts are published in Index Journal. We will be able to analyze the impact of this initiative in due course. Summarize: creating the culture of SOTL in health professions education institutes is mandatory, though it is challenging. It is possible to promote SOTL through good governance, which includes institutional commitment and leadership skills. Establishing a community of practice to promote SOTL seems to be effective based on our experience. However, this requires further research. Promoting health professions education requires high commitment equally from the organization and the faculty members. It is the responsibility of the institute to create conducive environment to carry out educational research. Evaluate, reflect, does your institute have a policy to promote educational scholarship? If yes, how does it benefit you as health professions educator? If no, will you attempt to propose one such policy to the leadership? Based on the strategy discussed in this chapter, prepare an outline of steps which you would like your administration to take for enhancing the overall scholarship development. What problems do you anticipate and how do you resolve them? Road ahead. Based on our experience and available literature, institution support in the form of good governance is vital in promoting SOTL. Strategies to be considered to promote SOTL at institutional level. Developing and implementing well-defined policies to promote SOTL. Facilitating a community of practice by establishing health professions education unit with dedicated faculty members. Providing administrative support. Training faculty members in educational research methods. Allocating dedicated time to carry out educational research. Creating necessary infrastructure including technology, e.g. recognizing SOTL through incentives, promoting innovative teaching methods like blended learning, identifying and nurturing talents, providing leadership roles to the deserving faculty members to promote SOTL,